So how many Canadians have already had COVID-19 and may not have known it? After a person has developed antibodies against the virus, how long does immunity last? A large-scale Canadian survey hopes to find out the answers to those two questions and more. Dr. Prabhat Jha is the survey leader and director of the Centre for Global Health Research at St. Michael's Hospital in Toronto and joins us this morning. Good morning to you.
Good morning.
All right, so how is this test going to work and who will get tested?
Well, as you mentioned, our question is very simple. We want to know how many Canadians have been infected with the virus that causes COVID. And to do so, what we will do is work with a reputable polling company, which is Angus Reid, and survey about 10,000 Canadians right across the country where we ask them online to just let us know some very basic symptoms that they might have had. And then we ask their permission to send them a kit, like you're seeing on screen, that they self-administer at home. It involves taking a little finger prick of blood and then putting it on these 5 circles. And they put it inside a safe mailer and send it to us. And in the laboratory, then we'll be looking at antibodies, probably running at least 2 tests to determine if they've had infection. And what we do is report back to the people, if they want, their results. So we'll tell them if they've been highly likely to be infected, somewhat likely, or unlikely. And as mentioned, then the plan is to repeat that survey a few months later and see if those that had antibodies, have they continued to have them, meaning they've got some kind of immunity, or is it perhaps more like the common cold virus so that the immunity falls, the antibody levels fall over time. And in a small subset, we'll be able to examine whether having antibodies prevents new infections from being acquired. So these are very basic but fundamental questions to help us understand how to control the epidemic. In particular, we are going to get much better information on older Canadians. So we're oversampling the Canadian population over age 60. And that's deliberate because that's the population at greatest risk of being hospitalized or dying. So we need evidence on how prevalent is the infection in our seniors.
It is going to be absolutely fascinating. You said you are mentioning that you're going to be testing those over the age. It is going to be fascinating to learn these results. We do appreciate your time this morning, and we look forward to a couple months down the road to see what those results are. Thank you, Dr. Jha.
Thank you.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.